more importantly, thank you for working with Senator Ige, Senator Green, and all of your colleagues in both the Senate and the House to collaborate this session. For me, it's been very exciting, almost to the point where I've been sitting on the edge of my seat, and I think many of us have been watching this unfold. It's been a very exciting session to see the legislation move forward that gives us the change that we need to ensure that we're able to continue to provide services to our community. There were three key bills for me, 200, House Bill 200, 1673 from the Senate, as well as 1364, which are providing additional funding, but most importantly, giving us some of the structural change that we need to continue to move forward as an organization. I've told someone recently it wasn't a step forward, it was many steps forward. So very grateful for your hard work, the collaboration within the Senate as well as the House. And with management of HHSC, many people don't know that we came to the table together on several occasions, along with board members, along with labor. Many hours were put in on your part as well as many individuals, so it's a fantastic move forward.
Why don't you tell us specifically, Earl, what you think about the changes? I guess for people out there hearing about it for the first time, one of the things that's changing is the makeup of the board. The corporate board, for big picture for people, we have 5 regions. Each region has its regional board of good community members, and each region has a CEO. You guys are 2 of the 5 CEOs. Now in the new bill, each of the regional CEOs will become a part of the parent board, and there'll be more members coming from each region. Just give us an idea what you think about that, good or bad.
That's an important point, Josh. In fact, I'd take a step backwards and go back 2 years with Act 290. This is another step in the evolution of the HHSC as a corporation and its facilities. 2 years ago, 290 created our regional boards, which shifted some of the decision-making, the policy setting from the corporate board to the local level. Healthcare is local, and it's extremely important to have that input from our local community members who are volunteers. They've put in many hours learning what hospitals are, learning how to be governing board members. They've been doing a fantastic job. I couldn't be more proud of our board in the West Hawaii region. So now we're seeing this shift in the corporate board, which I think is another step in this evolution, where, as you mentioned, the 5 CEOs from the 5 regions will become members of the corporate board, downsizing the size of the corporate board slightly, but more importantly, giving better representation, a stronger voice to management of the different regions. And it allows Howard and I, Wes Lowe, Vince Lee, Jerry Walker to come to the table more frequently and look at things from a high-level policy perspective. We've been meeting frequently on a regular basis at an operational level and somewhat at a strategic level, but this shift will encourage us, if not require us, to collaborate more on a strategic level, and I think that's a fantastic step forward.
Howard, you know, I want to thank you and Earl actually for devoting much time to helping us get a much better understanding of the system, and I really appreciate the fact that you all were willing to come to Honolulu and meet with all of us, you know, particularly in the Senate and with the other interested parties to try to forge something that would be a positive step. And I always think that you get a much better product when you have collaboration like that. And you know, so I would really want to thank both of you for your efforts in that regard. So tell me now, does the legislation give you more confidence in terms of the future of Hilo Medical Center, and perhaps you can explain to us what this means?
Unequivocally, you know, and first off, let me just say that newest CEO to the state and to Hawaii, I just applaud the efforts of the legislators. It is truly, as my colleague said, a step in the right direction, huge step. In that, you know, to me, I've seen at this session leaders who care, leaders who listen, leaders who are in touch. And so that's really refreshing. And so I just, again, applaud the efforts of you gentlemen and all that you've done with your colleagues as well. To me, this bill, and we encourage the governor to sign it, truly encourage the governor to sign it, because it's the right thing. It puts emphasis back on the regional levels. It truly calls for healthcare being a local phenomenon, and that's what it's all about. The decisions need to bubble up from the local communities. The engagement, needs to occur. Building relationships, that's what it's all about. We're in the relationship building business, and so we have to do that. And so it's imperative that we focus that way. So again, hats off to all of you. This bill, it's going to hold our feet to the fire to make sure that we're improving, checking our performance metrics, checking our just staying on task with value-added programs and making sure that we can deliver this message back to the legislators in a timely fashion. And, it's just really huge to me.
I'm really encouraged. One thing that's made me very happy, and thank you for those comments, Howard, is that, because first I should say, we really threw you into it. Shortly after you came aboard, we were diving right into this large process, because I would say that Senate Bill 1673, at least in the last 10 years, is the single largest healthcare reform bill that's been attempted. So it was a really large measure. So you really kind of came right at the peak of our activity. But one thing that is encouraging to me, and people get to see it, is to see the two of you here together, because I think health policy on behalf of the people gets formed at the level of your regional boards, right through to you, and then it's seamless, because you then are, as members of the corporate board, able to, whether it's to tell the governor or to tell people here at the legislature, hey, we need this. Or you can, I foresee anyway a big benefit in, let's focus on Big Island for a second. If Earl says, my community's been clamoring for oncology, more oncology services, cancer services, but it's going to cost, $10 million to hire several specialists, to get equipment, to get a state-of-the-art facility. I'm not saying that is exactly what we need, but I'm just saying you may say that. And Howard, who's at this meeting with you, is a fellow board member on the corporate board, said, you know what, my community in East Hawaii has for a long time wanted invasive cardiology services. We have an aging population. We have no ability to do cardiac catheterizations right now. We really need this. Well, you'll be able to say, good, if your focus is going to be on cancer treatment, I will help bring patients to you. And if your focus is on cardiac treatment, you'll be able to say to Earl, why don't you bring patients to us? And so we don't have redundant services on the Big Island, and so everybody across the island will benefit. And I hope statewide we achieve that. And I think that is going to it's going to have untold benefit by having such a high level of involvement of the regional leadership.
And I'd like to respond to that, because I think you're right on. I think with this new corporate board, what it will allow is for us there'll be many synergies, I think, that will develop from having the CEOs on this board. You hit on several in terms of services. Certainly, there are similar needs in these communities, and we can work together to put together collaborative arrangements. We're talking with, we're on a healthcare alliance now with North Hawaii, and so we're going to continue to look for ways to grow together. The Big Island, I think we're an island unto ourselves in many respects, and so we need to look to ways to grow together.
In fact, if I may, one of the big pieces of this bill was to allow for each of the regions to form relationships and partnerships. And it's interesting that you mentioned North Hawaii, because on Big Island we know we have